Hello, my topic is on selective abortion. So imagine you've been told that you are pregnant. If you can imagine that, most people are happy when they're told that they're going to be expecting a child, whether it's planned or unplanned. But then you get the exciting news, you're having twins. So now what are you feeling? Are you excited? Nervous? How do you plan for 2 babies at one time? Do you dream about having 2 children around the house versus just 1 child? And then you go for a follow-up visit. And if you can imagine now, you're told that there's something wrong with one of the babies. What are you feeling now? Fear? Anxiety? And then add to that, you're being told that the health of baby number 1 is affecting the health of baby number 2. And your happy pregnancy falls apart. What are your options? The mother must decide if she wants to continue the pregnancy or terminate the pregnancy. She runs the risk of deciding to have a child with a serious illness or disability. She risks premature labor or stillbirth if she continues the pregnancy. This is a difficult decision if you only have 1 child. But when you're pregnant with a twin, that decision becomes harder. And with a twin pregnancy where only 1 child is affected, selective termination of the fetus is a choice that might be presented to the mother. Before I proceed, a couple of definitions I want to go through. The first being abortion, which is usually the termination of a pregnancy prior to the first 28 weeks of pregnancy. And then the fetus, which is usually defined as a human baby who is unborn 8 weeks to 11 weeks after conception. So when you're faced with this difficult decision, whether you're the mother or the medical team, there are some considerations to be thought of. What is the risk to the normal fetus? Whether it's selective abortion, continuing the pregnancy, what is the risk to the normal fetus? What is the risk of total pregnancy loss? Again, whether you do the selective abortion or you choose to continue the pregnancy. What is the potential for preterm labor if you continue the pregnancy or if you have selective abortion? And what is the overall risk to the health of the mother? In Chile, there were 4 cases of monoamniotic twins. And in each of these cases, it was identified that one of the twins had a lethal cranial defect. And this was concerning because with the stimulation to the exposed brain tissue, there are unexpected movements that will happen with these children. They'll straighten out, maybe they're having seizures, but they can put compression on the umbilical cord of the, quote, normal twin. Or their movements could cause the umbilical cords to become entwined. So 2 of the mothers opted for selective termination of the affected twin. This resulted in the birth of a healthy remaining twin. 2 of the mothers opted for conservative management of pregnancy, which resulted in the death of both twins. Now this is a limited study because of course it's only 4 cases, but Chile does say that the health of the normal twin needs to be considered with any decision that is made. In Boulder, Colorado, there was a clinic that did a 20-year study from the years 1992 to 2012 of more than 1,000 women. And of those pregnancies, 16 of those twin pregnancies had 1 twin with a structural or chromosomal anomaly. 7 opted to terminate the pregnancy, and 9 opted for selective termination of the affected twin. It should be noted that generally these terminations took place after 32 weeks in order to promote the health and survival of the other twin. So what are the medical considerations in these situations? Well, obviously there's the gestational age of the child. Are they dizygotic or monozygotic twins? The fetus versus the mother. Our ever-increasing technology. We are aware of issues before they are born. We can take care of issues shortly after birth nowadays. And then the risk of the normal twin versus the expected outcome of the affected twin. The ethical considerations. There's the uncertainty of the diagnosis of the affected twin. So in those cases in Chile, it was an intracranial defect. Those children were not going to survive. But what if it's a cardiac anomaly? Maybe there's a chance of survival, maybe there's not. The best interest of the normal fetus. The autonomy of the mother and her best interest. And then how best to counsel the mother. She needs to be aware of all her options for herself, for her children, legally, ethically. She has a lot to consider. It also needs to be noted that the diagnosis of an anomaly may not occur until after the 28 weeks of pregnancy, when abortion is usually considered. What are the options for the mother then? She may be faced with no local or legal options for pregnancy termination. The ethical principles of beneficence, non-maleficence, and justice need to be considered. The desire to do good and avoid harm is complicated when the health of one fetus may affect the health of the other. Does it make the choice any easier when the affected twin's chance of survival is low? What if the affected twin has a good chance to survive after birth? Then, shouldn't the interests of both twins be considered? What if the anomaly of the affected twin increases the risk to the healthy twin? So now the interest of each twin conflicts with the other. There was a study done in Turkey where there was 31 pregnancies over 11 years that opted for selective termination for an infected fetus for major but non-lethal structural, chromosomal, and genetic anomalies. Their findings suggest that the risks are higher for pregnancy loss, preterm birth, and maternal risks when selective termination occurred prior to 24 weeks gestation. Risks were lower when selective termination was delayed until 30 to 33 weeks gestation. So what must be considered culturally, spiritually, and legally? Many cultures and religions recognize the consideration of a mother's health when considering termination of a pregnancy. Would the same be said for the safety of an affected twin who might be harmed by his ill twin? Is there a legal option for late pregnancy termination or selective termination? Back to the Chile study, selective termination was not an option in Chile. So both the mothers that were going for that option were referred to other facilities, and one of those mothers went to Argentina. At that time, Argentina did not allow selective abortion. However, the case was brought before legal and ethics committees, and since the desire was to improve the outcome for the quote normal twin, the procedure was approved. So who's the patient? Is the patient the mother, the affected fetus, or the normal fetus? What is the moral stand of the physician? Is termination of pregnancy or selective termination of an affected twin wrong? The ethical obligation of the healthcare team includes providing the best information available. They need to know the risks of continuing or discontinuing the pregnancy, the risk of survival or demise of the affected fetus, the risk to the normal fetus. And then we have to respect that woman's decision. We have to recognize the emotions she's feeling, no matter which decision she chooses, whether it's to terminate the pregnancy, to terminate one child, or to continue with the pregnancy and pray for the best outcome. It's a difficult decision she's having to make. And if we as healthcare providers are opposed to a woman's decision, we need to hand over care to someone who can best support that person during this difficult time. Other points for discussion would include burden. Is society being alleviated of a burden by not bringing a child with a health anomaly into the world? But then who defines burden? Is it defined by usefulness to society? By their financial contribution to society? Or is it the medical expenses and support that are needed in order to care for them? Another point for discussion is suffering. It was said in one of the articles that people with disabilities might suffer to a degree which would make their life difficult to live. Who defines suffering? Is it the medical field? Is it society? Or should it be left to individuals to define what suffering is? What about contributions to society? Mothers of individuals with Down syndrome felt that if they had terminated their pregnancy, they would have missed out on so many things like affection, cheerfulness, insightfulness, gratitude, and their humor. One mother was quoted as saying that if I would have known early enough, I would have had to make a difficult decision whether to terminate him or not. I'm very glad we weren't given that option, because I would have been facing the biggest mistake of my life. And some of the mothers that were being interviewed said that they feel that their children with Down syndrome are more in tune to their efforts and their feelings than their quote normal children. So what would be missed by terminating a child just because they have Down syndrome? How about the discussion for naturality, which implies that something is the way it is supposed to be without intervention? Anomalies have been present for years. Down syndrome was first documented in 1866. Where would we be without our history? And what about our future? Technology, as I said before, continues to advance. Years ago, you were surprised by the sex of your child. Now you can find out what the sex of your child is before they're born, and you can prepare. We can see that there's health issues, and we can have the experts in the delivery room to deal with those health issues right away. Or we can make decisions to not bring those children into the world. What about legal changes? Laws are always changing as there's new situations and scenarios that are brought forward for discussion and argument. And sometimes the laws will change because of it. Ethical changes. As technology changes and laws change, do our ethics change, or do our ethics change the laws? Societal changes. With more cultures being exposed in our United States, is there something that they're bringing to our culture that may change the way we see things in the future? In Boulder, Colorado, during their 20-year study, the proportion of patients seeking termination of their pregnancy due to an anomaly increased from 2.5% to 30%. So what's going to happen in our future? Will we get to the point where selective abortion is in relation to the sex of the child? Maybe I live in a culture where a male child is preferred and I find out I'm pregnant with a girl. Do I terminate my pregnancy because I'm pregnant with a girl? Alarming sex ratio changes in other countries are suggesting that this is already occurring. Will this movement reach the United States? Or has it already done that? The Guttmacher Institute had this table which showed that there are already some states that ban selective abortion based on sex. Is that because someone sought that, or are they just being proactive? So where will our future be? Do we make the decision not to bring a child into the world because of minor anomalies or only major anomalies? Are they considered a burden to society, or are they a benefit to society? Where will we be? Thank you.